Hi, my name is Samah Andy, and in my presentation, I will be talking about cultural competence. For the first half of my presentation, I will cover the definition of culture and cultural competency, the importance of being culturally intelligent, and how to be culturally competent as a medical imaging technologist. What comes to your mind when you hear the word culture? How would you define culture? Well, culture is the collective set of beliefs, values, customs, and behaviors that shape the identity and interactions of a particular group or society. In 1951, culture was explained and defined as sharing a pattern of thinking, feeling, reacting, and problem-solving. Culture is also a dynamic process of shared meanings arising from individual interactions. Culture must be understood within historical, social, political, and economic contexts. It encompasses many aspects, including language, communication style, traditions, customs, and perspectives on roles and relationships. Culture shapes individuals' perceptions of the world, influences their behavior, and defines their collective identity. It is a dynamic and evolving concept that varies across regions, societies, and groups. What is cultural competence? Cultural competence is the ability to interact effectively and respectfully with individuals from different cultural backgrounds, understanding and valuing their unique beliefs, values, behaviors, and communication styles. It involves having the knowledge, skills, and awareness to navigate diverse cultural contexts, promoting inclusivity, understanding, and equitable treatment. Culturally competent individuals and organizations demonstrate sensitivity, awareness, and inclusivity when working with people from different cultural backgrounds. They recognize and appreciate the diversity within society and strive to create an inclusive environment where all individuals feel valued and respected. To ensure equitable treatment and effective communication across cultural boundaries, cultural competence is essential in various fields, including healthcare. Cultural competency is the ability to identify and challenge one's cultural assumptions, values, and beliefs, develop empathy for people viewing the world through a different cultural lens, and apply specific communication and interaction skills that can be learned and integrated into clinical encounters. It is essential to be culturally intelligent for several reasons. Number one, effective communication. Culturally intelligent individuals can navigate and communicate effectively with people from diverse backgrounds. They understand and respect different communication styles, nonverbal cues, and social norms, which helps to avoid misunderstanding and foster positive relationships. Number two, building relationships. Cultural intelligence promotes building solid and meaningful relationships with individuals from different cultures. Understanding and respecting others' cultural values, beliefs, and behaviors makes establishing trust, rapport, and collaboration easier. Number three, avoiding stereotypes and prejudices. Cultural intelligence helps individuals challenge stereotypes, biases, and prejudices towards different cultures. By understanding the unique aspects of each culture, individuals can avoid making assumptions based on generalizations and treat people as individuals rather than stereotypes. Number four, promoting inclusion and diversity. Culturally intelligent individuals promote inclusivity and diversity in various settings, including workplaces, schools, and communities. They create environments where everyone feels valued, respected, and included regardless of their cultural background. Overall, cultural intelligence is crucial in promoting effective communication, building relationships, fostering global perspectives, in challenging stereotypes, and promoting inclusion and diversity in various spheres of life. As a medical imaging technologist, what can you do to be culturally competent? You would need to learn about different cultures, customs, and practices, understand the beliefs, values, and traditions of the diverse populations you may encounter in your work. Develop self-awareness by reflecting on your biases, prejudices, and assumptions. Be aware of how your cultural background might impact your interactions with patients from different cultures. You would also need to practice good communication skills that promote understanding and respect. Use precise language, listen attentively, and ask open-ended questions to encourage patients to express their concerns or preferences. Respect diversity by treating every patient with dignity and respect regardless of their cultural background. To be sensitive to cultural differences, you would need to recognize that cultural norms and perceptions of healthcare may vary. Be open to different rituals, alternative medicine practices, or religious beliefs that patients may follow. Cultural competence is an ongoing process that requires continuous learning, reflection, and open-mindedness. Stay updated on the latest research, guidelines, and training on cultural competency in healthcare. Attend workshops or seminars on cultural sensitivity. Arrange for patients to have interpreters when necessary. They can help bridge language or cultural barriers and ensure effective communication between you and the patient. You might need to modify your approach based on the patient's cultural needs. This may include adjusting positioning, attire, or communication style to accommodate cultural preferences or religious requirements. You would need to be aware of healthcare disparities. Understand that certain cultural groups may face healthcare disparities due to socio-economic factors, language barriers, or limited access to care. Advocate for equitable healthcare for all patients. And lastly, foster a welcoming environment by creating an inclusive and welcoming atmosphere in your workplace. And now for the second half of my presentation, I will focus on the main points to remember if you encounter a Muslim patient and the main things to consider when dealing with Muslim patients. As a female Muslim myself who wears the hijab, I possess a deep understanding and empathy for the needs and experiences of my fellow Muslim individuals. The main point to keep in mind that Islam is not a race, it is a religious faith. With over 1.8 billion followers worldwide, Islam encompasses many cultures, languages, and traditions. Muslims come from diverse cultural and ethnic backgrounds, including Arab, Turkish, Persian, Indonesian, and African. This diversity contributes to variations in cultural practices and traditions among Muslim communities. Muslims do not all look alike. Arabic is the language in which the Quran was revealed, making it significant in Islamic religious practices. However, Muslims worldwide encompass speakers of various languages, leading to linguistic diversity within the Muslim community. Despite the diversity, there is a homogeneity in certain core religious beliefs and practices across Muslim communities. Various factors, including religious teachings, cultural practices, and individual beliefs, influence Muslim views of health and illnesses. In Islam, health is viewed as one of the greatest blessings God has bestowed on humankind, and it is a religious duty to look after it. Muslims often hold a holistic view of health, considering the well-being of the body, mind, and soul. They emphasize maintaining harmony within oneself and the surrounding environment. Muslims believe everything happens according to Allah's will, including health and illness. They believe seeking medical treatment is essential, but healing comes from Allah. Islamic teachings emphasize the importance of prevention and self-care. Muslims are encouraged to maintain a healthy lifestyle through a regular exercise, proper nutrition, cleanliness, and avoiding harmful substances such as alcohol intake and smoking. Seeking medical treatment is strongly encouraged in Islam. Muslims believe Allah has provided humans with intellect and knowledge which should be utilized to seek appropriate medical care. The general understanding is that medical interventions are part of Allah's mercy and can help facilitate healing. Few aspects you need to keep in mind when looking after a Muslim patient in the radiology department. Number 1 is dress guidelines. Islam does have modesty guidelines that encompass dress. These guidelines vary depending on cultural and regional practices, but generally they encourage men and women to dress modestly and cover certain body parts. Modesty is an essential aspect of Islamic teachings. Women are allowed to take their hijabs off in front of family members who are forever ineligible for marriage to her, such as her dad and her brothers, and also in front of other women, and of course her husband. If you encounter a Muslim patient, provide a private and comfortable environment for the patient, ensuring they have appropriate clothing or coverings during imaging procedures while maintaining their dignity and privacy. To accommodate the privacy and modesty for hijabi female patients during examinations that involve changing, it is essential to ensure that they do not walk in front of male staff or other male patients. Let them change in the examination room whenever possible to avoid having them walk around the department. This helps maintain their comfort and preserves their cultural and religious considerations. Muslim patients may prefer healthcare providers of the same gender, especially during sensitive procedures. Try accommodating these preferences whenever feasible, ensuring the patient feels comfortable and respected. Also, respect for religious practices. Be aware of any religious practices or obligations the patient may have, such as fasting during Ramadan. Fasting in Islam means no food or water to be ingested between sunrise and sunset, with some exceptions. Respect the religious practices and make necessary accommodations, such as scheduling procedures or appointments accordingly. When scheduling appointments, engage in open and respectful communication with Muslim patients to identify their needs and preferences during Ramadan. Whenever possible, offer appointment slots that align with the fasting schedule of Muslim patients. Muslims are highly encouraged to break their fasting if medically indicated. However, they prefer to postpone specific elective medical procedures after Ramadan. Be aware that any injections break the fasting. In healthcare settings, some Muslim patients may benefit from having a Muslim support person present during medical consultations or procedures. This support person can provide emotional support, help with communication, and ensure that the religious or cultural needs are respected. Healthcare facilitators are often accommodating and understanding of such requests when appropriate. It is important to remember that while these aspects give more general insights, there may be variations among individuals or cultural practices. Therefore, it's always best to have an open and respectful communication with Muslim patients to understand their particular needs and preferences. I will summarize my presentation in a few points. For all the patients with different backgrounds, keep in mind that effective communication is critical. Ensure clear and respectful communication with the patient, considering any language barriers. If needed, provide interpreters or language services to facilitate communication and understanding. Also, be sensitive to cultural practices and customs. Understand that cultural practices may vary amongst individuals, so it is crucial to approach each patient and inquire about any preferences or needs related to their cultural background. And for Muslim patients, provide a private and comfortable environment for the patient, ensuring they have appropriate clothing or coverings during imaging procedures. And also be aware of any religious practices or obligations the patient may have, such as fasting during Ramadan, and schedule procedures or appointments accordingly. Thank you for watching.